Vitreous Health, Beyond Insights.
The sophistication of being able to take a tool like PSCI and be able to have the analytics in there for the discrete data involved in the care in the ambulatory setting, which is the amazing part of this tool, being able to measure the chronic conditions. And now at our practice, Urologic Specialists of Oklahoma, we're partnering with PSCI and we're building outpatient algorithms which we're measuring the state of health scores of our urology patients. If we do a surgical intervention or if we put them on a different drug, the tool's got the ability to measure state of health scores before the intervention and after the intervention. And I think that's a powerful formula to have to be able to negotiate with managed care players in the marketplace. The thing that distinguishes PSCI from other companies in America is they come in and work with our practitioners, and we're co-developing that. They're not coming in with a cookie-cutter approach to this. Our doctors are sitting down, we're working in a collaborative fashion, we have meetings, and in our four algorithms that we've done, we've spent over a year working on those because we take it, we build the data elements, PSCI goes back, programs that into their tool, we give them a fresh download of all of our electronic health records, we bring the data back, the doctors go at it for a second time, look at the formulas that have been written, take the measurement of the patients and say, did in fact those give us the high-risk patients that we knew about from everyday care practice out there? And I think that's the important step that PSCI takes. We validate the formulas that we've written before we go forward. And I don't have one doctor doing it. I've got a committee of 4 urologists all sitting down and writing the formulas with PSCI, which makes this distinctively different than those products where you just buy them off the shelf. As I traveled around the country and joined this group 2 years ago, I couldn't find anybody that was writing algorithms and state of health scores. Everybody's writing guidelines and protocols on the how-to. And so when I took this concept to Urologic Specialists of Oklahoma, our 22 doctors, I said, I think we'll be on the cutting edge. And I think partnering with PSCI, we can build a model for the entire country. Well, I think they're very unique in the fact that these are computer people coming together with clinicians, working in the clinic domain. They're right there with the doctors in the room as we write these algorithms, and they're asking questions and they're probing, and they're helping the doctors understand what the computer tool will do, and the doctor is sitting there providing them the ranges of the discrete data as we build these formularies. And so they've got an ability to sit and work with the doctors real time in the room, and that's what sets them apart from other vendors. I think the thing that's what's special about PSCI is they've obviously got the computer knowledge, they have programmers, they also have the ability to do the mathematical part of this process. They've got the ability to bring algorithms to this model of care that I've never seen anybody in the industry be able to do before. What I've seen in the past is you have 4 or 5 or 6 different systems that are operate in isolation from each other. And the founders of PSCI have taken all those disparate systems with their capabilities around wrapping this around algorithms, taking data and measuring things consistently with refreshes out there, and that's what differentiates PSCI. When we lived through the HMO days back in the 90s, as we had capitation sorts of things, we had no computer tools back then. And so you were flying blind, and maybe you made money and maybe you didn't make money. I think what PSCI brings to clinics and why I highly recommend it to all doctors and hospitals in the country is as we go into these new payment models again, and whether you call it capitation or bundle payment, it's all still the same. You're being paid based on a set defined amount each month. And if you don't have a tool, like a PSCI tool, you're not going to be successful in this. You're not going to be able to prove that you've got good outcomes, nor are you going to be able to measure the cost equation side of this and know if you're making money. There's all sorts of complex formulas out there for the bundle payment world or the outpatient world. The founders of PSCI can write algorithms for every different payment model. You may have 6 or 8 of them in your market, but what PCI brings to the table is they can write a different algorithm for every payment and bonus incentive for every doctor and provide real-time analytics back to the organization. It's one of the amazing developments of PSCI I've watched over the last 12 to 15 months. Working like in an HMO world or an insurance world, they've been able to take all these different algorithms and all the pieces of the pie and put it together in the PSCI tool. And they've been able to identify those patients that are high